everyone. I'm Dr. Kartik, Department of Neurology, JJ Hospital. I'd like to share a few words about epilepsy. So, is epilepsy curable? I would say it is partly curable. There are few seizure disorders where people might be taken up for the surgeries and can be cured and achieve seizure freedom in them. But most of the epilepsies, majority of them require long-term optimal medical care to keep them seizure free. Diet in epilepsy. Recommended diet would be ketogenic diet, but I would suggest keep the targets which are achievable and make sure you have frequent meals which are protein rich and low carbs, and try to maintain the diet so that you will not bounce back and take high carbohydrate meal. What are the safety measures for the epilepsy patients? If you are not seizure free, avoid driving, swimming, and operating heavy machinery which would endanger life. I would suggest epileptic patients who are not seizure free to have a handy midazolam spray with them and educate their friends and relatives about the disorder they are suffering from and use of the midazolam spray whenever they have an activity. This would prevent the prolongation of the seizures and would act as a vital first aid for them. Tips for safe pregnancy when you are epileptic. Make sure you plan pregnancy, take folic acid prophylaxis, and seizure free before pregnancy, and choose one drug which is less teratogenic and go for it. Make sure you attain a seizure-free period before pregnancy because the risk of seizures in pregnancy would go up if you don't attain the seizure-free period before pregnancy. During pregnancy, you should have a regular follow-up and go for the therapeutic drug monitoring of the antiepileptics, and make sure in second trimester the dose have to be adjusted. Mostly it has to be increased to a certain extent to maintain the therapeutic levels. What are the safe drugs for the women with epilepsy planning pregnancy? I would say levetiracetam and lamotrigine has very minimal teratogenic effects and very good control for the people suffering from epilepsy planning pregnancy. C-section or normal delivery. Epilepsy is just risk factor, not an indication for C-section. Yes, you have to breastfeed the child because breastfeeding has more beneficial effects than the risk of anti-epileptic secretion into the breast milk.